This is St. Vincent's Health Talk, a video magazine with the latest news and developments from St. Vincent's Health Services. In this edition, as always, we start with safety first by highlighting the great catch of our associates. We celebrate the opening of the Dispensary of Hope, as well as recognition for our stroke and orthopedics programs. We discuss needed change in our walk-in urgent care centers and discuss the expansion of St. Vincent's College's program. At St. Vincent's, we're investing in the future and working hard to be the hospital of choice for patients, employees, and physicians. Now let's turn to our news summary. We begin this edition of Health Talk discussing safety, just as we do each morning in Safety Huddle and at the beginning of each meeting at the Medical Center. The Medical Center has impressively increased awareness about safety with the rollout of numerous tools which will help us become a high reliable organization. Carrie Eaton, Chief Administrative Officer, discusses why safety is at the core of all that we do.
Well, high reliability organization is really just what it says it is. It's that you should be able to rely on the organization to do the right things for patients all the time, not just some of the time. And there are certain behaviors that are associated with high reliability organizations. One of the things that we learned was that there's behaviors associated with, for example, always making sure that patients don't get an infection when they're on a ventilator. And there's maybe 4 or 5 things that if we do it every time, we can make sure patients don't get infections on ventilators, where we used to think that that was sort of the cost of being on a ventilator, that some people would just get ventilator-associated pneumonias. Now we found out that there's certain behaviors that if you practice them regularly and reliably, you can keep patients safe. And if you do this all the time, you can reliably not have a safety event for a patient when you're in the hospital. So our work has been to teach patients, or to teach our patients, our families, but mostly our employees, how to practice these safe behaviors so that we don't have unexpected adverse events for patients that are within our own control.
One of the elements of being a high reliable organization is to reward and recognize our safety heroes. In this episode of Health Talk, we celebrate the great catch of Maria Duke Ferrara of 6 North, who identified a patient in distress because of her great observation and teamwork.
We had a 39-year-old male who came in for a procedure for an angioplasty. He was extremely anxious to go home. It was a beautiful day outside, and he really didn't want to wait for his attending. With much persuasion, he did stay, and at one point I passed by the room. He didn't feel so well. We hooked him back up on the monitor, and he had very ST elevations, and I called the physician assistant, came down, evaluated him, texted the cardiologist, and he did say, oh no, he's discharged, and she responded, we have a PIMI right here, right now. He came down, the cardiologist came down immediately, spoke with the cath lab, and within 6 minutes he was down the cath lab. And he ended up having a big clot in one of his coronary arteries, and he did very well after everything was done.
In January, St. Vincent's College launched a new online Bachelor of Science program in nursing. The program is designed to support the goal of the American Nurses Association to have all nurses now working obtain their bachelor degree within 10 years of RN licensure. Dr. Martha Schuldis, President, CEO of St. Vincent's College, discusses this new program.
What's an RN to BSN program? The RN to BSN program is a bachelor's degree program designed for diploma and associate degree nursing graduates, licensed nursing graduates, who are then interested in earning a bachelor's degree in nursing. Some of the things that are unique about the St. Vincent's College program is, number one, it's delivered online. We discovered that as we investigated who would be the logical students for this BSN completion program, it was clear that, number one, they were proven learners. These are people who completed associate or diploma nursing programs, got licensed, and are now practitioners. These folks have proven that they know how to learn and are disciplined enough to enter into and complete a online type of program. These are people that can learn as much from each other as they learn from the faculty member that may be working with them, and complete the program in a timely fashion, move on to other kinds of career roles, or continue on in their current role. Why would one want to get a baccalaureate degree? Number one, I mentioned earlier the more complex nature of the workforce setting right now, but another reason is that opportunities for advancement come more readily to those people with the advanced degrees.
Currently, 26 nurses are enrolled in the BSN program. And now for our feature stories. February is the coldest month of the year, and for St. Vincent's, the busiest in terms of putting our best foot forward for outside surveyors. In addition to the Medical Center's triennial 4-day survey, our stroke program, joint replacement, and trauma program were also visited by a team from JACO. We have not yet heard the outcome for our trauma program. However, our stroke program has once again been designated a primary stroke center. The team led by Dr. Suranath Kadimi and Jennifer Nascimento deserve recognition, along with our emergency department staff. With patients experiencing a stroke, time is of the essence, and it's critical to get a patient to the emergency room as soon as possible.
Hi, I'm Jennifer Nascimento, stroke coordinator for the stroke program.
I'm Angela Tingle. I'm the nurse manager for the stroke unit here on 7 North.
We have met all the criteria for JACO, which is quite a feat because it's really a hospital-wide
Continuum of care?
Yeah, it's a continuum of care. It's not just this floor, it's really the hospital, from EMS to ED to 7 North to our ICU, so it's really multidisciplinary. And
don't forget 6L.
yes, 6L. A patient would want to come to a certified stroke center because they could feel comfortable that we are delivering the best care that's based on clinical research and best practice guidelines. And our goal is to deliver standard of care to every stroke patient that comes to St. V's.
The first joint replacement program for hip and knee, certified by the Joint Commission, St. Vincent's was reaccredited once again thanks to the hard work of Shanice Nicholas and her team. Here in the acute rehab unit, Shanice discusses the importance of rehab in patients who have just undergone joint replacement.
Our total joint program was the first orthopedic program accredited in 2007 by the Joint Commission for Fairfield County. For our patients, we have a very dedicated team, a multidisciplinary team that actually works with our patients from the time that they're scheduled for their procedure until they're actually discharged. This reaccreditation is just a symbol of our commitment, as well as the fact that the Joint Commission acknowledges all of the quality outcomes we provide for our patients. Our patients are very educated now. They actually are very savvy, and they use the internet to look up the hospitals who will give them the best outcomes post-operatively. So if any patient decides to do a search on hospitals within the state of Connecticut where there are outcomes for orthopedic surgery that are actually measured, they would be able to look up St. Vincent's and see that it's accredited by the Joint Commission and that it meets a standard for quality that they recognize.
In April, St. Vincent's, along with other members of the Primary Care Action Group, celebrated the opening of Connecticut's first Dispensary of Hope. Located at 752 East Main Street, the dispensary will provide prescription medications at no cost to uninsured and low-income patients in Bridgeport. St. Vincent's Mission Vice President Bill Hoey discusses the significance of the Hope Dispensary.
We're part of a national group called the Dispensary of Hope, which is an idea that was born in an Ascension hospital, our parent company, Ascension Health, that has now blossomed to 70 retail pharmacies throughout the country who offer hope and medication to people without access to medication. So we are the first program in the state of Connecticut. We opened just 2 weeks ago. This is the result of a whole lot of organizations coming together. St. Vincent's was blessed to kind of be the initiator of this effort. The folks at the Dispensary of Hope came up with this idea, why don't we get the doctors and the drug chains to donate their sample medications? We will set up a centralized warehouse to ensure that the medications are, appropriate, have not reached their expiration date, there hasn't been a recall, there's not a problem with the medication, and then redistribute those donated medications to local communities where there are people in need of medication.
The dispensary is part of a growing national network of clinics and pharmacies throughout the nation. St. Vincent's parent company, Ascension Health, gave a grant to support the program. Also supporting the project are the City of Bridgeport and the State of Connecticut, which donated the space for the dispensary, which is housed in the Department of Health building. St. Vincent's is proud to be part of this project and the Primary Care Action Group, which is a collaboration of area health services organizations focused on advocacy and education to ensure that every person has access to affordable health insurance coverage. Recognizing the need for change is much easier than actually initiating change, but the leadership of the medical center recognized that our immediate healthcare centers needed some retooling. Enter Dr. Frank Schifo and Director of Emergency Services Kathleen Woods, who took over the operations of the centers a few months ago. The first task was the rebranding of the centers and the renaming of the IHCs to reflect nationally accepted nomenclature, urgent care, walk-in. Dr. Schifo discusses the significance of the name change and the overall improvements patients are experiencing.
For many years, the immediate health care centers, which were really a hybrid of both occupational medicine, workman's compensation cases, and urgent care cases, the walk-in, so to speak, were housed under the same roof with the same staff, and there was really not much distinction between the two. In the early fall, the leadership of the hospital approached both myself and Kathleen Woods to join their efforts in becoming a team to promote separating out the two service lines. We want to really take an opportunity or embrace the opportunity to allow both service lines to grow, to allow us to provide more services, to serve more people in the community. We're very pleased that for the very first year, the Fairfield County Weekly Reader poll has selected St. Vincent's Medical Center urgent care walk-in centers, they refer to them as walk-in clinics in the poll, as #1 in Fairfield County. So we're quite delighted to have received that recognition.
In April, the walk-in center saw an increase in patient visits, partially due to the rollout of a marketing campaign, which included print and radio advertisements. We conclude this issue of Health Talk with St. Vincent's new TV ads airing on regional cable and local network TV. Developed by Noreen McNicholas and Lucinda Ames of the Marketing Department, with video production by Manhattan Place Entertainment. The stars of these ads are from our Department of Oncology and their patients, and their stories are real.
I was given 3 months to live.
It was devastating news for me and my husband. We have 3 young children. The type of cancer and the tumor was 1 in 40 million.
A team of physicians at St. Vincent's diagnosed the case, and then life-saving surgery was performed.
He's been cancer-free for 3 years.
The Elizabeth Freem Swim Center for Cancer Care in Bridgeport, a single destination for comprehensive cancer care.
Thanks to St. Vincent's, I'm here to tell my story.
Thanks to St. Vincent's, I got a second chance at life.
A team led by Dr. Stuart Marcus removed a cyst from Arvetta's pancreas. Analysis later confirmed that the cyst had cancer on the surface. The surgery saved her life. Arvetta then entered St. Vincent's Survivorship Program, which focuses on healing the mind, body, and spirit. St. Vincent's Medical Center in Bridgeport, a single destination for comprehensive cancer care.
Thanks to St. Vincent's, I'm here to tell my story.